Bismillah ar-Rahman ar-Rahim. I'll talk today about the future of medical training in Egypt and the role of CEMTA. Now I'll start with the present status of medical training in Egypt. Do we have a national program for foundation level, whether it is 1 or 2 years? Do we have a licensing exam? Do we have a national CME CPD accreditation system? Do we have a relicensure system? Do we have a unified training programs for postgraduate certificates? Unfortunately, we don't have. And that's why the role of CEMTA stopped. What's CEMTA? CEMTA is the compulsory Egyptian medical training authority, which was established by virtue of the Prime Minister's Decree number 210 of 2016. As an authority affiliated to the Presidency of the Council of Ministers in accordance with the strategic vision of the state in the development of the health system by developing the level of clinical medical training for graduates of medical schools and their exams to ensure safe medical practice. The activities of the authorities, standards setting for the content of professional and specialized medical training, lays the foundation for evaluation and re-evaluating doctors at different levels, issuing and accreditation of any professional medical certificates in specialized field, performs the national licensing exams for practicing the medicine and re-licensing process, develops the specifications and accredit medical institutions for training of different medical specialties. This is the board of directors. The board of directors is a dominant authority over its affair and may take whatever it deems appropriate to achieve the objectives of the authority. It's composed of chairman, Secretary General, Chairman of the Medical Studies Sector Committee in the Ministry of Higher Education, 6 deans representing, again, represented in the medical studies sector in the higher education, 1 dean representing Al-Azhar Medical School, 3 members of the armed forces, Director of the Medical Services of the Police Authority, 3 members representing the Ministry of Health, Head of Medical Syndicate, and 1 of the public figures. As you see here, it represents all the responsible person for training all over Egypt. While the function of the authority is done through committees, we have 2 different committees, Central Scientific Committees and specialized scientific committees. The central one, responsible for developing the general strategic basis for training programs and the examinations, which applies to general and specialties training examination. While the specialized scientific committees in medical specialties and subspecialties aim to develop a detailed training programs and the examination system in the context of the policy set by the Central Committee. Each committee consists of 13 members, 8 from the Ministry of Higher Education, 4 from Ministry of Health, and 1 nominated by Military Academy of Medicine. All members of the scientific committee are required to have MD degree in this specialty. The committee may include 2 members from abroad and with the same condition of its member. And here we apply to do 1 from the Western country and 1 from the Gulf area. Now the general overview of the CEMTA activity through these 3 central committees. 1 for the House Officer, 2nd for the CPD, and the last one for the Egyptian board. I'll start by the Central House Officer Committee. The strategic plan of this commission, establishment of a national program for the training of the house officer doctors, 1 year in the meanwhile, that can be used in university, military hospitals, and all health ministerial hospitals and accredited health centers. Second is establish a system, standards and preparation of a national exam for practicing the profession after completing the national training of the distinguished physicians for 1 year. The goals assure that the graduate is competent and safe in performing the specific tasks assigned for the primary health care provider. Second one, to prevent and manage common and life-threatening conditions and the clinical presentations he or she is expected to face. And the objectives of this program: to practice the clinical skills she or he acquired in the undergraduate years to gather relevant and precise clinical information, integrate the essential knowledge to prevent, diagnose, and provide primary management for common and life-threatening medical conditions. Outline management plans for the common and life-threatening medical condition, being aware of the scope of practice, when and where to refer patients beyond this scope, which is very important. Perform diagnostic and interventional procedural skills he will be responsible to do as a primary health care provider. And lastly, communicate effectively with patients and relatives to promote health, explain management options, and take informed consent. The level of performance for each skills start from observation, practice under supervision, and ended by independent practice, not the 5 performance level known in the advanced level of training. This is the core procedures, 20 core procedures, and beside each procedure, the level of performance needed. For example, vital signs, independent practice, blood culture, practice under supervision, IV infusion of blood and blood products, independent practice, perform and interpret an ECG practice under supervision, demonstrate competency in cardiopulmonary resuscitation and basic life support, independent practice. The house officer doctor must show the following attitude: approach to patients, cooperation and respect of colleagues and paramedics, handling responsibility, organizational and administrative activities. And the rotation required skills in the Department of General Surgery, General Medicine, Pediatrics, OB/GYN, Emergency, and Electives. And the rotation skills in the form of clinical lectures, clinical competencies needed in each department, form to be filled and signed by the supervisor for each competency, whether satisfactory or non-satisfactory. Practical skill and manual procedures with documentation of their performance for each skills in each specialty. Regulating standards for implementation of house officer program. The places where the training doctor can be trained and general supervision of the training program with the selective criteria and the assigned responsibility, similar for a dedicated supervisor, is appointed for each training session. Now, currently we are working on collaboration with the Egyptian Knowledge Bank to help in providing e-materials used to learning required professional skills before doing them in real life during the training program, and preparing a national program for the training of house officer doctors in the 2 years foundation level. Now, the second category of the functions in the CEMTA is the continuous professional development department, with its 3 tasks: to set up a CPD system in Egypt, to set up system for revalidation of the license for healthcare professionals, to set up criteria for promotion of healthcare professions at Ministry of Health, which is pending. This is the CEMTA CPD bylaws, which ended already at 2018 with its contents. We start to CPD skills. You know that it is more broad than CME, as medical, ethical, managerial, social, and personal skills. As the CME is an ingredient of CPD, and CPD as a professional development is directed to all healthcare professionals. CPD covers all learning activities, including CME, professional, and managerial competences. Now, the duties of individual health professionals to attend CPD accredited activities, to keep a record of their attendance in his portfolio, give a feedback to the CPD providers regarding the quality of activities presented by the CPD accredited provider. Now the categories of CPD activities. Category A, which is external credit, like this conference, it is outside the institute, outside the hospital, including external speakers, external guests. Category B, internal credit, inside the hospital or institute. And lastly, category C, which is personal credit. It involves self-directed learning activities such as reading, medical writing, or completing activities that are not from national CPD accredited provider. Now the types of CPD activities, for example, live educational event, B, e-learning material, blended learning, scientific activities, quality circles, and supervisions. Activities not eligible for CPD credit points. Not all the activities is accredited, like with the morning rounds, activities in the department, community and patient awareness session, software skills. All these activities not eligible for CPD credit points. Now, CPD providers eligible to apply for CPD accreditation. The organization should be legally recognized, for example, higher educational institutes, medical societies and associations, health professional education and publishing companies, government agencies, healthcare facility like hospital, department, medical center, clinics, foundations and other non-profit organizations. Now the hours calculating method in CPD. One calculational hour equal 1 CPD hour of E. A participant can claim up to 8 CPD hours per day of the E, and maximum CPD hours for any program is 30 hours. The maximum accredited CPD hours for any lecture within the program is only 1 CPD hour, even if the lecture period for more than 1 hour. Now the following time are not calculated, like the registration, summary, coffee breaks, prayer time. These hours are not calculated in the CPD program, and ended by accrediting the events. The future plan of CPD, community awareness website on CEMTA website, international accreditation, whether it's the Gulf countries, Europe, UK, North America, and the accreditation of e-learning providers, whether national, regional, or international. Now the last activity in our authority is the Egyptian board. Egyptian board, it includes professional certificates granted by the authority in a range of medical specialties, and includes internationally recognized standards for postgraduate studies in medicine. It maintains strict controls for evaluation and accredited physicians in various general and branch specialties. It supports continuous medical education for all physicians. The programs of Egyptian board, the number of years of training for the Egyptian board are generally 5 years. Specialty committees are allowed to specify number of years required for their specialization. For example, for family medicine, it's reduced for 4 years, and in case of neurosurgery, it's increased to up to 7 years. At the end of the training, the student will receive a certificate of completion of training, which is board eligibility, after fulfilling the following conditions: the end of training period, the trainer's signature on the logbook, which is electronic logbook, approval of the supervisor to grant the certificate of completion of training, and now the board exams. The final exam will be held at the end of the training. The student will be evaluated periodically all through the training years according to specialty committee training programs. Requirements for the Egyptian board final exams: obtaining a certificate of completion of the training, which is board eligibility, and fulfilling the requirements of the specialty committee. The 4 specialties that started the program already is general medicine, general surgery, OB/GYN, and pediatrics. And now the newly added 7 specialties: cardiology, anesthesia, and intensive care, ENT, cardiothoracic surgery, ophthalmology, pediatric surgery, and emergency medicine. These scientific committees had been already formed and started their meeting. In order to summarize, 3 main institutions or 3 main bodies presented from the presidency of the Council of Ministers. One is the Ministry of Higher Education, with its huge infrastructure of the training places, which is a university hospital, and also contains the main bulk of the trainers in the form of the staff. With the Ministry of Health, with a huge infrastructure of training, but less preparation with the trainers, contains the main bulk of the trainees, will cooperate and regulated by the CEMTA in order to reach our ultimate goal, which is patient safety. Thank you.
نشكر الأستاذ دكتور ياسر سليمان